There are many factors that affect someone's health and well-being. These are called social determinants. And one of the main ones that I wanted to focus on was socioeconomics and how that socioeconomic status could affect your health outcome and overall health well-being. So first, I want to first talk about what socioeconomics is. This is the way that someone's social and economic factors affect the way they live. So the ones that we will be comparing today are mostly of high middle class and then lower income areas where it is people that suffer with poverty. So the reason why this topic is so important to talk about and research is because there's such a large group of people in the world that are living in poverty, and everyone in the world will need some sort of health care at some point, and your health is one of the top priorities in your life for an outcome in life. So that is why it's so important to research. And then I personally selected this topic to just bring light to the situation and create equality for my current and future patients. I think that no matter where you are in the socioeconomic levels, that you receive the same care. So first, I wanted to research different topics within the socioeconomic range and see what different factors also affected the health outcomes of different people. So the first article that I researched was about admission lengths of stay for different people, and the different factors that they put into this article were race and then socioeconomics, and they broke it down into two categories. One of them was patients being discharged to their home, and one was being discharged to not their home. For their home, they found it pretty similar for equality of people with different socioeconomic backgrounds and also of people different races. They were same amount of days of discharge. Now, where it got different was when people were being discharged into a place that is not their home, and for race, people who were in the minority, non-white people, saw a increase in the number of days that they were staying in the hospital. It went from 0.21 to 0.32 days, and this study was from 2009 to 2014. So between that time, there was an increase that we saw that disparity in that. Then along the lines of socioeconomics, they saw that there was a huge increase for lower class socioeconomic groups that went from 0.02 to 0.36 days, which is a huge increase for these statistics. And they weren't quite sure. They wanted to do more research into why there was a big difference between home versus non-home discharges, but they did find that there was an discrepancy between the level of socioeconomics that a person came from and their race. This was important to look at because the price of healthcare is increased by the amount of days that you're staying there. The quality of healthcare and all the above is just changed by that. The next article that I looked into was about healthcare disparities, and this one was mostly about this article was mostly about the visual acuity of patients and how socioeconomics and age has affected those. So they looked into two types of visual acuity problems. The first one was diabetic macular edema, and they found that people who qualified for this group were typically of the age of 60. So those younger age groups weren't as affected by these visual impairments as other groups. And then what they mainly found was that people who were Hispanic and people who use Medicaid as their insurance were people who had lower visual acuity and that they were affected mostly by these visual impairments. And they also found that diabetic retinopathy was most common in African American patients and that there were lower levels in people who were white. And they counted this for people not getting the care they needed earlier and receiving different injections and stuff to help their visual health. So they also identify that there's fewer education on this topic in places where groups are affected, and so they wanted to provide more education to those groups to improve their visual health. And then they also found that younger adults were less affected. So this was just finding a discrepancy in the areas for education to provide better care for people's visual health based on their socioeconomic status. The next little area that I wanted to research was based off of people's overall health. And the article I found was based off of obesity with a relation to COVID-19. And this article found that there was higher mortality rates for people when they had COVID-19 if they were considered obese. And if they did not die, that there would be more severe outcomes and symptoms after getting COVID than if you were not obese. And they wanted to look into this article about why people were being affected by obesity, and they found that people with lower socioeconomic status were only able to purchase cheaper foods, which were more caloric density and not as nutritional for you and highly processed. So these food choices were really affecting the way people were eating and their weight. So this weight is directly correlated to socioeconomic status, and which overall is affecting people when they get diseases like COVID-19. So the next thing I did was an interview with my great aunt, Carol Bembrick. She is a registered nurse. She has been for 40 years, and she worked in med-surg and in the ER. And so I wanted to interview her to see how the socioeconomic status of people has changed and how the healthcare for those patients has changed. So originally she talked about how the behaviors of doctors and nurses that were treating these patients often didn't want to because originally they didn't have any health care, which meant they couldn't pay for their treatments. So they were seeing a lot of patients coming in with severe cases because they were putting off medical needs until the last minute because they could not afford the care. And a lot of the doctors would treat these people poorly because they knew they weren't going to get money out of it, and treated them differently just because they were of a lower socioeconomic status. And obviously there was a discrepancy in race as well during that time. The treatment of the patients, they just weren't receiving the care that was equal to others, and she said that a lot of the times they would have worse problems than most people that came through there and would leave in not as great shape as other patients. So her interview was great insight. For my personal reflection, I would like to see some action done for education for the public on health and where to receive it. These groups that are being affected by this different health problems and stuff should receive more education on routine cares, and that they should get yearly vaccinations and routine checkups through their Medicaid, and get that care and how to fix that. I think there should also be education for healthcare workers to be less biased towards these patients that need Medicare, who are of lower socioeconomic status, who are not of the same culture or race as you, so that there isn't that implicit bias when treating these patients. And I think also addressing insurance companies on access to care and price of care, that these people should receive the best care that they can despite having Medicaid. That's something that should be equal. So I think that addressing this with the Senate, Congress, and the President through healthcare workers would be the best change. My action plan personally is that in the near future, I want to be an advocate for my current and future patients. I want to make sure that they're getting equal care no matter if they are on Medicaid or private pay. I want to make sure that no matter what their race or background, that they are receiving equal care and the best care that they can get. Continuous education for my patients and for myself to learn about these different cultural groups and how to help out with socioeconomic groups would be great. And then also just teaching others that I come across in my work field about these discrepancies and what I've learned through this course. So the conclusion is that people of lower socioeconomic groups are at risk for worse outcomes with different health problems, and that these minorities and lower socioeconomic backgrounds are not currently receiving equal care, and they weren't receiving equal care before either. So I think we all just need to band together as a society and also as healthcare workers to create a better future for all patients, no matter what their status is.